Ms. Mariam Jaafar. Yes, please.
Thank you. As a daughter of a former nurse, I literally applauded at my seat when DPM announced the increase in healthcare worker salaries. It is long overdue. Besides being a welcome signal of the increasing recognition of the need to recognize the value of healthcare workers and the work that they do, one hopes that this will go some way to addressing the shortage of nurses and other healthcare workers today, and as our population ages. I would like to know if the government has any expectations or targets for how much we can close the gap in the demand with this move to increase compensation. And if a gap yet remains, what more we can do to meet the demand for healthcare workers and where the biggest obstacles are, from the life cycle of recruitment to advancement to retention. On recruitment, I would like to ask about the adequacy of spaces in our nursing programs in our tertiary institutions, as well as any data on leakage of students in nursing programs that do not go on to become nurses, and why. I would also like to know the success rate at hiring people from other backgrounds into nursing. We heard some of that, I think, earlier in the debate, as well as the success rate of getting back former nurses and other women returning to work after some time off. On advancement, I would like to know what is being done to enhance the career paths for healthcare workers. On retention, I would like to know the top reasons why healthcare workers quit and what is being done to address each of these drivers, including a review of shift structures, both working and off-work schedules, because a lot of research shows that the impact of shifts is more about off-work schedules than actually the working schedules, and the support resources available to nurses. My next cut. The COVID pandemic showed the necessity of a whole system approach in addressing a national crisis. Many doctors and nurses in private practice stepped forward as volunteers, and private hospitals took in recovering COVID patients at subsidized rates to free up capacity in public facilities. Such partnerships between public and private facilities also exist outside of a crisis environment. I have had residents who are public patients telling me they were referred to Raffles Hospital for their x-rays, and much to my relief at whether they were making the right decision, I learned that they were going to be offered a subsidized rate. And as a result, they were able to get the x-rays done earlier than the queues at the public hospitals would otherwise have allowed. Mr. Chairman, the private hospital sector is an important part of the healthcare ecosystem. As the pandemic plays out, we may see some shifts in demand. For example, with more private sector patients opting to public care if they lose their jobs and their insurance, and of course the changes to the IP plans. I would like to ask the Ministry if there is opportunity to optimize the current balance of healthcare in public versus private facilities and better leverage private sector partnerships to provide care for public sector patients, in particular our subsidized patients, of course, which of course would require the right incentives across the delivery chain. Similarly, our private GPs who play a critical role in MOH trusts to shift healthcare beyond hospital to community as part of the goal to provide accessible, affordable, and best care for all. I'm heartened that we continue to build primary care capacity and strengthen primary care networks, including for mental health. But of course, it's not just about expanding capacity. Alignment of interests, incentives, and processes are also key. Having GPs and community nurses with special interests and training, giving GPs and nurses direct access to specialist advice, and closer teaming and better communication with doctors, which I know some private doctors do really effectively over email and WhatsApp, giving GPs and nurses access to a broader range of diagnostic tests are proven levers to transfer care to the community. At the same time, reducing overall demand through direct demand management at the GP level and continued education efforts to make informed patients. I'd like to ask the Ministry what is being done to enable and empower our GPs and nurses to deliver care in the community. Thank you.